I am Dr. Jacob Teitelbaum. In recent episodes, we talked about how to tell if Candida was imbalanced in the body, and also if large intestinal bacterial imbalance was present as well. Today, we're going to talk about the small intestine and how things should be there, which translates to the small intestine should be sterile. Most people don't realize that. The body keeps a large amount downstream. You put things in your mouth, goes to your stomach, goes down to the small intestine, which should be sterile, and then everything dumps in the large intestine, which should be teeming with healthy bacteria. But if your movement of the current downstream from your mouth to the small intestine to the large intestine is too slow, you get backwash of bacteria into the small intestine, and then you can have imbalance that needs to be addressed with. Now, the question is, how do you tell? We can go ahead and do a test called a hydrogen breath test. But what I recommend instead is a much more low-tech, simple approach. Remember in grade school there'd always be one little kid who had gas that had that sulfur rotten egg smell. We called them silent but deadlies. When silent but deadlies are present, that suggests bacteria in the small intestine because it cleaves sulfur off of the bacteria, off the proteins there. When the silent but deadlies are present, this is very suggestive of bacterial imbalance in the small intestine. And a very simple way to address this is with an herbal mix called Ultra MFP, like Mary, Frank, Paul, Forte. 2 twice a day for 1 month, just one bottle. And you'll find that smell usually goes away and it will rebalance the healthy bacteria in the small intestine. But if you find that the problem keeps coming back, it's time to look at things that cause the current in your intestines to be sluggish, such as low thyroid. You'll find that optimizing gut health will leave you feeling so much better. I'm Dr. Jacob Teitelbaum, wishing you great health.